Addie. I'll be your nurse today. We are going to get your vitals today, and I'm going to do a head-to-toe assessment. So I'm just going to wash my hands, and then we'll get started.
Okay.
So I'd go over here, actually wash my hands in the sink, 30 to 60 seconds, warm water, soap, dry my hands off. I could put gloves on. I'm not going to for this patient. Can I verify your name and date of birth?
I'm Kinley Johnson, 2/13/98.
Alrighty. And do you have any allergies?
I do not.
Okay, so that is all correct. So this is my patient. This is who I'm doing an assessment on today. Alright, sweetie. We are going to go ahead. I'm going to put this on your finger. This is going to measure your heart rate and your pulse ox. So you can just rest that. How are you feeling today?
Great.
Great. Are you having any pain?
0.
0? Awesome. That's good to hear. Go ahead and take your blood pressure, okay? So much. Alrighty, the patient's blood pressure is 120/74, and her SpO2 is 97, and her blood pressure is 90, or not blood pressure, her heart rate is 95. Alrighty, I'm gonna take your pulse real quick, alright? Nope, you are perfect. Alrighty, I counted her respirators for 30 seconds and they were 16. And now I'm going to do her temperature. Have you had anything cold or hot to drink in the last 10 or so minutes?
Nope.
Okay. Alrighty, under your tongue. Alright. Her temperature is 98.3. Looks good. Your vitals look good. Now I'm going to do more of the assessment, so I'm going to kind of touch you first if you don't mind, and then I'm going to listen to you, and then at the end I'll have to just percuss and push on your belly a little bit, alright?
Mm-hmm.
I'm going to push you up a little bit so I can access you a little bit better. Alrighty, so I would just look at my patient, look at her hair, look at the skin color of her face. I would just look in her hair, see if she has any lice or anything in that. Her color in her face looks good. She looks like she's breathing well. She's got light pink skin, warm skin. I'm going to go ahead and touch her chest here, okay? So right now I'd be feeling for crepitus. And then I'm also going to feel your lymph nodes, okay? Okay. Those all feel fine. And then I'm going to go ahead and check your pulses and just your capillary refill. So the capillary refill, we're just looking at how your blood flow is returning to those fingers. Those all look good. I'm also going to feel both pulses. So both radial pulses feel equal and bilateral. They're strong. Same goes for those. I'll check the carotid one at a time so I don't make you pass out. Alrighty. So I'm going to go ahead and listen to you. I'm going to kind of listen to your whole chest and belly and everything all at once, okay? Alright. I'm going to go ahead and check her carotid since I just checked that as well. Sounds good. I'm gonna go ahead and listen to her heart, and then I will listen to her lungs after that. Alright, so heart sounds good. Have you ever had any heart problems before?
None.
No dysrhythmias or anything?
Nope.
Okay. Alrighty. Do you mind sitting up on the side of the bed? How do you feel sitting up? Good? Okay. I'll put it, oh, that's okay. You want to swing your legs around this way for me. Just don't go flying off the bed for me. Oh, you can, oh, you can sit. There you go. Okay, so I'm just going to listen to your lung sounds, okay? Take deep breaths. Good job. Good job. All right, I'm going to go around on your back side and listen to your lung sounds there as well. Everything on the front sounds good, heart sounds good, lung sounds. Deep breath. Good job. All right, one more. Lung sound good. There's no signs of her having any respiratory distress. She sounds clear, no crackles, no wheezes, anything like that, no stridor. I'm going to have you lay back down. And then I'm going to go ahead and feel on your belly and everywhere. Is that okay? Yep. I'll actually listen to your belly first, and then I'll feel it on your belly.
Okay. Can I pull my shirt up?
No, you're fine. My sounds are fine. No. Your all four quadrants sound good. Active, not too active, no hyperactive, just perfect sound. I'm gonna go ahead and push on your belly. You tell me if anything hurts. Do you have any discomfort in your belly area right now?
Nope.
Nope, okay. So I'm just gonna push on it. Feels good. I'm gonna percuss as well. Okay, so it's good. I'm also gonna do that up here. Check your lungs. Good. So I percuss on her belly and her chest just to check, make sure there's no like dull sounding. Oh, can you sit up one more time for me? I'm so sorry.
Yes. Get up.
There you go. Okay. So I'm just gonna check your back as well. I'm gonna percuss on your back. We're gonna just check those lungs and the kidneys back there. Okay, and then I'm also going to press my arms on your back, and I'm going to have you say the word 99, all right?
99.
And again.
99.
And again.
99.
All right, everything sounds normal. Let me just check a few things for you. And you can lay back down. I will get your, I'm going to check all of, I'm going to do your pedal pulses after I trip on your shoes. It's a full risk there. Alright, so I'll do your pedal pulses. And also feel this as well. Everything feels normal. And you said no pain in your belly at all? Okay. I'm just gonna do a test, and if I I was just checking that to see if there's any tenderness in your belly or any chance of you having appendicitis. All right. Is there anything I can get you today? Nope. Nope. Okay. I think that's it. Oh, just kidding. Cranial nerves. I didn't even check your eyes. Okay. So I'm gonna go ahead and look in your eyes, ears, and nose. Sorry, getting all the bats all okay. Okay. Alright. No, looks good, looks clean. Clean patient, you're good. Good. Looks pink and normal. I will have you open your mouth and say ah for me. Alright. Just looking in the back of your throat. Don't see any like pink, pussy, anything that's like inflamed at all. And I'm going to also use this light. I'm gonna just look at your pupils, okay? There we go. So pupils dilate, and then it also dilates as well. And I'm just gonna look up your nose real quick, okay? That looks good. Everything looks good. Her nose looks clear, just looks pink normal. No, nothing abnormal. Alrighty. I'm going to do your cranial nerves, which is right here. I feel this way. Okay, can I have you close your eyes? Okay. I am going to test you.
Sorry.
And I'm just gonna have you sniff and tell me what you think you smell, alright? Peanut butter, you are correct. So that is testing the olfactory, the first nerve. I'm also going to, let's see, could you stick your tongue out for me? Okay, and so that will test the hypoglossal, the last nerve from the motor of the tongue. If I were doing optic, I would just use like a chart or a magazine or something to have her look over, see what she can see. The oculomotor nerve, I would just have her blink her eyes. If she was capable of that, she would be fine. For the trochlear nerve, I would have her just look up, down, and then that means good motor to her eye. The trigeminal, I could either have her clench her jaw or touch her forehead, cheek and jaw line gently. For the abducens, I could look at each side of her eye, which I already did that in my assessment. The facial nerve, I could have her smile, look at the symmetry of the face, make sure there's nothing drooping. The vestibulocochlear nerve, I would have her close her eyes. I would either snap my fingers or have someone have her stand on one foot to see how her balance is going. And then the glossopharyngeal nerve, I would just have her swallow to look at how her swallowing is. If it's normal, that's good, because if we're giving her PO meds, then she needs to be able to swallow those. The vagus nerve, I would check the pulses, and accessory nerve, I would have her shrug her shoulders, and then we already checked the hypoglossal, so those are all the cranial nerves. Alrighty.